Good evening, everyone. I am Sanya from Prostate Wellbeing Team. I am sure all of you must be keeping good health. Today, we are going to discuss a very important topic that is called renal calculi or kidney stones. Kidney stones are hard pebble-like pieces of material that form in or one or both of your kidneys when high level of certain minerals are in your urine. Kidney stones vary in size and shape. They may be as small as a grain of sand or as large as a pea. Really, some kidney stones are big as golf balls. If you have symptoms of kidney stones, including severe pain or bleeding, seek care right away. A doctor, such as a urologist, can treat any pain and prevent further problems, such as urinary tract infection, UTI. To throw more light on the subject and guide us on what's right for diagnosis and treatment of kidney stones, today we have with us renowned urologist Dr. Gopal Ramdas. He is a MS DNB Urology. He has a rich experience and hands-on expertise in urology, BPH, and stone management. He is currently practicing at AINU Hospital, Hyderabad. Dr. Gopal Ramdas has rich experience in the field of urology and carries out the renal calculi diagnosis and treatment with utmost precision and efficiency, ensuring that patients' health is in safe hands. Welcome, Doctor.
Thank you.
Doctor, as we are going to discuss a very important topic, my
Yeah.
very first question to you is what are basically kidney stones?
So first I will share my screen. Is the screen is visible?
Yes, doctor, it is.
Yeah. So before going to the details of how the kidney stones are formed, we'll just go through how the urine is formed. So this is the small video which shows how the urine is formed actually. So this is the kidney, and kidney has a basic unit called nephron. So in the nephron, whole of the blood from the body is get filtered. So all the red blood cells, they are not filtered. They will be passing through the circulation, and the substance which are not which we don't want get filtered through the this nephron. So this process, it goes on continuously through the body, and then the urine is formed. This is the out of the urine. What are the substances which we require? They are reabsorbed, and what those substances we don't require, they are excreted through the kidney. So per day around 0.6 to 2.5 liters per day is the urine production. So coming to the question, what is the kidney stone? Kidney stone is a hardened mineral deposit or concretion which forms in the substance of the kidney or bladder. It begins as a microcrystal, like small crystal, then develop as a collection of crystals, and then as a stone over a period of time. So we'll go through the quick video how the kidney stones are formed. You can see there are the small calcium, and these are the oxalate crystals. So when there is more calcium in the urine, or when the calcium intake is more, and oxalate in the body, what we eat in the food, they combine and they join calcium and oxalate, they join and they form the stone. So this process goes in the renal papilla, from where the urine comes from the kidney to the collecting system. So this single calcium oxalate, they combine and they form a nidus, over which similar calcium and oxalate, they join and form a stone. And this process, there is a process of formation and retention of the stone. So over a period of time, this stone comes from the kidney, enter into the ureter. So here in the kidney or ureter, this will grow in the size, and this stone form in the kidney comes to the ureter. There are three common sites where the stone can be blocked. Is the first is a pelviureteric junction, then second is the iliac crossing, and third is when there is an entry into the bladder. So these are the three areas where the stone can get blocked. What body tend to do, like when the kidney stone is formed, it try to expel out of the body. So it comes from kidney and enter into the bladder over a period of time. It is if it is small stone. So what kind of stones we can expect? Like calcium oxalate is a majority of the stone. Some are calcium phosphate and some are uric acid or cysteine stone. So coming to the mechanism, how these stones are formed. Now you must have seen this experiment in childhood. When we add the sugar or salt into the water, then initially this sugar or salt get dissolved into the water because the concentration of water is more and the concentration of sugar is less. But as we go on adding the sugar or salt into the water, if the concentration of sugar goes up more than the water, it will not dissolve, it will precipitate, and that is the similarly the stones are formed. So coming to the next question.
Okay, very well explained, doctor.
Yeah.
And coming to the next question, what are basically the symptoms of kidney stone? How somebody can identify, or what are the initial symptoms which one can identify that these are the
Yeah.
symptoms of kidney stone?
Right. So coming to the reasons, like coming to the symptoms, now how the patient present, how the patient will have come present to you when what will the symptom? First will be the flank pain. The flank pain will be there, like from it will be from this is the loin to groin, that is from back side to the front side. The second will be the pain in the lower abdomen. So this third will be the pain in the urinary passage, depending upon the stone is whether in the kidney or whether in the ureter, whether into the bladder. This symptom will vary depending on the position of the stone. Sometimes it may erode, sometimes it may damage the urinary mucosa and lead to the blood in the urine. Some patient will have vomiting and frequency and urgency of urine, and some patient will not have any symptom at all. In the routine checkup, they will go to the physician and they'll found to have some big stone in the body or kidney. So this pain is typical, like it will be acute pain, it is sharp pain, and it will come and go. This period of the pain will be around 20 to 60 minutes, and this pain will vary depending on the location of the stone. So if it is lodged in the urinary passage, because of the stone is lodged in the urinary passage, the pain goes on increasing.
Okay, so these are the symptoms. If somebody is having pain or bleeding, then they must go to a urologist.
Yeah.
Doctor, is it like that kidney stone have some age barriers that if somebody is above 30 or above 40, is it like that kidney stone will occur to those person only, or it does not have any age barrier?
No, there is no age barrier. You can see that kidney stones can form from any age. Like there is a 12% life incidence of the kidney stone. So men, they are 2 times more common versus women, and this incidence can be from childhood. It will increase up to the age of 60 years. After 60 years, very less amount of the less number of people will experience the stone. And once you get a stone, there is more likely that after 10 years, you have 50% chance that you will get the stone again. So age is not a barrier and sex is also not a barrier. So it can occur in any patient.
Okay, doctor. And
Yeah.
doctor, what causes kidney stone? What are the main causes, if we can say that, these are the particular causes of kidney stones?
As you say, as I discussed earlier, that when the urine becomes super saturated, like when the concentration of water, like decrease amount of urine is there, if the water amount, if your intake is less, your urine will be less. If there is abnormal pH, like some have acidic pH, some have alkaline pH, and some patient will have infection, these are the reason for the stone formation. So the important reason is low urine volume. If you drink less amount of water, you will have low urine volume, and the concentration of the solute in the urine is more, so it will be precipitated. The patient will having a diet having
Okay, so
rich
it
in
is
the.
important to drink a lot of water.
It is not like that you should drink 3 liters or 4 liters of water. You should drink the water till the urine color is white. If your urine color is yellow, that means your intake is less. So depending upon the summer or winter season, you should analyze your urine color. It should be white. In summer, you can see that your urine color is generally yellow. Why? Because your intake is less, and demand is more because of sweating. So there is evaporation, there is excess water loss is there. So to To compensate that, you should drink more water so that your urine should be white. The second important reason is diet. So diet which is rich in the animal protein, like non-veg diet, like chicken, mutton, or fish. Those having diet rich in animal protein, they are main reason for the stone formation. Some bowel condition, the obesity, some medical condition like diabetes and obesity, some medications, and some patient will have family history. So like those like the father or mother, they have stone, then the children, they will more likely to get the stone. There is around 2 to 3 times more incidence than the common population in the family history is there. And some patient, there will not be any reason, like some metabolic disorders are there, like those patients who are having more calcium excretion in the urine, like they are putting more calcium in the urine, more oxalate in the urine, they will have more stone formation. Some patient will have structural kidney disease, like there is some blockage in the urine pipe or some polycystic kidney disease. These are the reason. Those who are horseshoe kidney, like the kidneys are joined in, normally the kidneys are like this. Some patient will have horseshoe kidney like this, they are joined inside. So these anomalies, they will more likely to get the stone disease. And in some patient, often there is no underlying causes found. We cannot find around 60 to 70% of patient, we can find the reason why they are forming stone. But around 20 to 30% of the patient, we cannot find the reason even after various tests we do, we cannot find the reason.
Okay, doctor. And as you have mentioned that kidney stone also occur if somebody in the past or in the family have
Yeah.
kidney stone. So
Yes,
is it
yes.
like that that it can pass to one generation to another?
That there is a less than 5 to 10% chances that they will pass from one generation to two generation, second generation. But whatever they drink, the family is, because suppose some water is little hard, some will have borewell water, so they have more concentration of these solutes like calcium, and these will be more harder water, so they will have the more tendency to form stone.
Okay, doctor. And doctor, as we have discussed the causes, the symptoms, here is a question that do kidney stones form in one or both kidneys? It is possible that kidney stone can occur in both the kidneys, or is it how do kidney stone form in
Yeah.
one or both kidneys?
Yeah, a kidney stone can, one can get kidney stones in both kidneys also simultaneously also. Sometime one followed by other, like one kidney in this time. After 6 months, they will get a stone in the other side, like other kidney. So this is common. This is possible.
Okay, so it is possible that one can have kidney stone in both the kidneys.
Right.
And doctor, when we are moving forward and now talking about the treatment, so how kidney stones are treated, and do all the stones require surgery?
No. So coming to the treatment part, so before treatment, how you diagnose this will come to this. Like patient will give typical history, and on examination we can see there is a tenderness in the back or there or not. Some blood tests are there and some imaging. So the ultrasound, whenever patient get a pain, patient will go to the doctor and doctor will ask for ultrasound. So ultrasound will pick the stone very easily. Like you can see in the first part here, you can see that ultrasound is showing this whitish shadow, that is a stone. And this is the swelling in the kidney, you can see. So swelling in the kidney occurs when there is a blockage in the urine pipe. Coming to the next investigation is X-ray KUB. So X-ray KUB can see the stone. You can white shadows you can see here, and these are the stones. And the last one is the CT scan. So CT scan is the investigation of choice. Even 1 millimeter of the stone can be picked with the CT scan. So if you have doubt that you have stone, you have to better to go for CT scan. So this CT scan or imaging, they will help you to find whether you have stone or the stone is there or not, and it will rule out other reasons for the stone, other reasons for the pain. So if you do X-ray, there are only 60% of the chance you will get a stone, like picked up, because the 40% of the patient will not picked up with the X-ray. We have to do CT scan for that. And for the patient who are pregnant and children, the ultrasound is investigation of choice, because there is no risk of radiation in the ultrasound. Coming to the treatment, as you asked, patient comes with the pain, so we have to give pain relief tablets or injections as per the demand. And to control infection, we'll start antibiotic. we can give medical expensive therapy. We can manage with the medicine some stones, and some require the intervention in the form of surgery. So patient will ask, what that will I pass the stone? So that reason, that answer, that depend upon the size and what is the level of obstruction, where is the stone is blocking. You can see if the stone is less than 5 mm, around 75% there is a chance that he may pass the stone with the medicine. If the stone is more than 5 mm, there is a this chances come down to 46%. If the stone is in the upper part or upper ureter, 20% of the chance that he will pass the stone. But if it is in the lower ureter, there's 70% chance he will pass the stone. And this medical exposure therapy, what we call, we ask him to drink plenty of water. We'll give some medicine like alpha blocker like tamsulosin, we'll give painkiller, and we'll observe the patient for the symptom. If patient, we can wait at least 2 to 3 weeks with this medical management for 5 to 10, 2 mm stone. If in that 5 to 10, 2 to 3 weeks, he gets like vomiting, fever, or persistent pain, despite of the medicine, he will require surgery. So these are the indications of the surgery. So in the form of hydration, analgesia, and when we should consider to hospitalize the patient, when there is an infection like fever, when there is intractable pain, and when is persistent vomiting, he is not taking orally. That time we have to do the hospitalization. So this, hope I clear your doubt that which patient we should treat with medicines, and which patient will give medicine and we can wait for the stone to pass out spontaneously.
Yes, definitely, doctor. Very well explained that people who have 5 mm or less kidney stone can definitely, though does not require surgery, and there are medications which can help in passing
Right.
the kidney stone as well. Doctor, as we are discussing about kidney stone, we also have a live viewers watching this live, and here are some questions by them.
Yeah.
So I read that for you. Here is
Yeah.
Anshul asking,
Yeah.
could I have a kidney stone and not have any symptoms?
Yeah. It is possible. Hello.
Yes, doctor.
Yeah, it is possible. Sometimes some patient, like especially generally, you can see small stones will cause a problem. But if the stone is big, which is growing into the kidney, and it may grow from 1 centimeter to 2 centimeter, 3 centimeter, and go unnoticed over a period of time, until unless you do any investigation in the form of ultrasound for any other reason, you will not come to know that you have stone. Until unless you get any infection, you will not come to know that you have stone. So it is possible that you will have stone, but you will not have any symptom. There are 20 to 30% of the patient will not have any symptom.
Okay, doctor. And doctor, sometimes people also ignore the symptoms, when they have pain and such symptom, but they don't
Yeah,
go to urologists and take over-the-counter medication. So, what is your message to the
absolutely,
people
absolutely correct.
who do this?
Absolutely correct. You're correct. So generally, those patient, like those are some workers or like low middle class family people, they will do go and they will ask for medicine over the counter. They will take medicine, the pain will be relieved, but over a period of time, because of blockage, because of pain, the kidney function, what is there at the time of pain, it will go on reducing over a period of time. Like after 3 to 6 months, the function of the kidney will go down, and after 1 year that patient will come to know that his kidney function is totally zero now on one side because of stone. In that case, we cannot save the kidney by removing the stone. We have to remove the kidney as well as stone at that time. So this is very dangerous. You should not neglect any pain which you are getting. You should consult your physician, and accordingly, if you get a stone, you have to consult urologist.
Definitely,
Otherwise,
doctor.
the function of the kidney will be at the stake. Right.
Yes, doctor. And as you mentioned that a lot of people do this and take over the counter medications and think that, it is working. But as you said, that it can be harmful for them in the long run.
Yeah, yeah. We see
And
many patients because they are neglected and they are end up into the removal of the kidney.
right. Right, doctor. And doctor, as we have talked about the treatment as well.
Yeah.
So is it like that, what amount of fluid a person should drink when somebody is having kidney stone? And is it important then to drink a lot of water? Because we have also heard that, drink a lot of water, the kidney stone will pass it on. And, people do that as well. Instead of going to a urologist, they consider that, drinking a lot of water can definitely help. What is your take on that?
Drinking a lot of water in a patient with a stone will help if the stone is passable, like around 5 to 6 stone, which is possible. But like bigger size stone, like 8 10 stone, 1 point like centimeter stone, they will not pass despite you take water. Like because the ureter where the stone is blocked, the size of that pipe is around 4 to 5 So if the stone size is bigger than that, it will not pass, and patient will get pain and pain again and again, because the kidney is getting swollen because of the kidney is producing urine. It is coming from kidney to the ureter till the stone is there, but that urine is not coming out of that ureter into the bladder. Whatever urine he is producing from the opposite kidney, so that swelling will go on increasing, and then he will have trouble. So just drinking a lot of water, having a stone is not a solution. That drinking a lot of water will help in the stone less than 5 to 6 stone.
Right, doctor. And doctor, as we have discussed the treatment, the symptoms, the causes, how the kidney stone is formed. What is basically somebody, now we are coming to the prevention part, that how can someone prevent themselves? What are the prevention measures which one should definitely take for the formation of kidney stone?
So before going to the prevention, we'll go to the treatment part. Like what we have done, this is the medical treatment we have seen. Okay, so there are some surgical treatment we should understand. There are very uh, now advanced technique or advanced technology. Without any suture or without any cut, you can treat the stones. Like first, I would like to discuss the ESW treatment. You can see here ESWL. Here the patient lie on a water filled cushion, and the surgeon uses ultrasound to locate the stone. Like ultrasound is there, or x-ray is there, that will localize the stone. Now you can see from surface the it is localized, and then from the this ESWL machine, high energy sounds are passed, waves are passed through the body without injuring it, and these stones are broken into the small pieces. Okay.
Yes, doctor.
This video is visible.
Yes, it is visible.
Video you can see
We can see a picture.
a
Can you
video.
please play it?
You are seeing the picture. Okay, let me.
Please play it.
Okay, okay. Now it is seen.
Yes.
Yeah. So the patient lie on the water cushion, and here surgeon or urologist will use X-ray or ultrasound to localize the stone. Now we can see the target, and we target the stone. And with this ESWL machine, that high energy sound waves are they are passed through the body without injuring the kidney and break the stone into the small pieces. Okay, so these small pieces over a period of time they are passed from the kidney to the bladder. So this is the ESWL, which is non-invasive, and here patient doesn't require any anesthesia. Patient comes and undergo ESWL, and in the same day we discharge the patient. So this is good treatment for some set of the patient. Coming to the stone in the ureter, like ureteric stone, you can see here white shadow in the urine pipe, and because of this stone, there is a swelling in the kidney and ureter. So video is seen. So here you can see on ureteroscope we are passing, and you can see the animated view also. This small endoscope we are passing from the urethra to the bladder. Gradually we are going from the till the ureter till the stone is there. And once the stone is seen, you can see the stone in the endoscopic view. Once the stone is seen, we take a laser machine, okay, and through the that endoscope we pass a laser fiber. So this, with the laser fiber, you can see the stone is broken into the small pieces, or it is dusted. Video is not playing. You are able to see the video?
Yes, doctor.
Yeah. So the stone is seen. This is the laser machine, and with the laser we fragment the stone into the small pieces, or we dust it like a powder, like a flour mill powder. So these are the, and this is completely clear of the stone, okay. And then we'll put a stent. This stent is temporary, and we'll remove the stent after 2 to 3 days, 2 to 3 weeks.
Okay.
Then coming to the kidney stone, you can see the kidney stone. For that, we do the RIRS. RIRS is also small endoscope. Will pass from the, this is the small flexible scope, from urethra. You can see into the urine pipe, or this is ureter, and from ureter will go gradually up to the kidney, where the kidney stone it is. And after going into the kidney, we'll take a laser. We here the we are inside the kidney. We are inspecting the all the inner layer part of the kidney, just to see the other stone is there. Now you can see that white patches you can see inside. Like these are the white patches. I will show again. And this is the stone. This is the stone. So once you localize the stone, we fragment it with the laser, and this fragment will come out. These are the white patches you can see inside.
Yes,
So
doctor.
yeah, so this stone is fragmented, and then this fragment will come out over a period of time with the stent. Then we'll put a stent. This is the stent placement. So for large kidney stone, like you can see the stone is how big it is. For
Yes.
this stone, we do the direct puncture. We directly puncture the kidney from surface, okay, and will this is directly we are puncturing to the kidney, and we dilate that area, dilate the tract. You can see in the animation. We'll put a small tube there, and we'll pass an endoscope inside. And with the this lithoclast machine, we'll break the stone into the pieces, and these fragments will remove with the grasper or with the forceps. You can see how they are getting removed, and this stone is completely clear. So now coming to the question, now for prevention, as you asked, like prevention, we have to treat the underlying cause, like whatever the medical disorder, like patient is having diabetes, or is having other medical conditions which are hyperuricemia. These treatment like gout condition we have to treat. Then for obese people, we have to reduce the weight. The weight reduction is an important measure. Adequate hydration, as I told you, your urine should be white irrespective of the weather. In the summer, also you should drink the amount of water so that urine should be white, and in the winter also you should drink amount of water. The urine should be white. The diet which is important, like decreasing the solute load in the form of non-veg diet, you should reduce. Salt diet you should restrict. Like suppose many people are many majority of the here in Hyderabad, they are software people. They will eat outside food which is very rich in the salt. Sometimes they will reach non-veg food. So these are the that increase the solute load into the urine and cause the stone. Some medications are there, some are there. There is a long list which medicines can cause stone formation. And we should reduce the intake of food which is rich in the oxalate in the form of spinach, chocolate, and nuts. And cranberry juice is important to take. Like some patient having a recurrent stone disease, we advise them to take cranberry juice. So these are the important preventive measure. Apart from that, you should check your calcium uric acid level. So in 70% of the patient, you will have high level of calcium or uric acid. So if we treat that, if you with the medicines, your future chances of recurrence will come down. And those patients who are forming stone again, we request them to do ultrasound every 6 months, so that if the stone is small, we can manage with the medicine. If the stone is big, he may require surgical treatment.
Okay, doctor, and very well explained that how the treatment is done and how there are various treatment options which are available now. If
Yeah.
somebody is having a large kidney stone as well, it can be treated with a lot of measures. Doctor, here are some live viewer questions.
Yeah.
Who are watching our live. So here's a question coming from Yuvraj asking, are there any dietary changes recommended for prevention of kidney stone?
Yeah. So as I told you, dietary changes are common dietary changes. Intake of water should be more. The intake of salt will be less, and intake of non-veg should be reduced. These are the three dietary measures. You should not take excess of those people who are having like a fitness freak. They will have more spinach, more palak in their diet, because they will eat raw these vegetables, and they will form stone because they are doing exercises. They sometimes they will eat whey protein or something. So this protein load will be more, and because of exercise, the water will be lost because of exercise, because of sweating. So these are the people we are more prone for the stone formation.
Okay, doctor. And here is another our viewer asking that are there any natural remedies or home treatments for kidney stones?
Yeah, natural remedies are there. First important natural remedy is drink plenty of water, that I also always say. Second, if you, the fruits which are rich in the citrus, like citrus fruit, like oranges, avla, or this or cranberry juice, these are the treatment as well as preventive measures for the future stone formation.
Okay, doctor. And doctor, here is Yashika asking, are certain people more prone to developing kidney stones?
Yeah, absolutely. So these people we need to evaluate thoroughly so that they should not form the stone in future. So we have experienced one patient, one lady was there. She had a stone. We treated that stone, and after 3 months, she got another stone in the same kidney. So she came to us and she was saying that, "Yeah, last time we did surgery, and again within 3 months, how can I form the stone? Last time you have not treated my stone at all." She was arguing with us. Then we have evaluated her with some blood tests like calcium, uric acid, and parathyroid, and she will come. She found to have high parathyroid levels. Parathyroids are the glands which are behind the thyroids, and that are important for the regularizing the calcium metabolism in our body. So her parathyroid levels were around 500. Normal level is around 80. So we have evaluated her with the ultrasound neck and found to have her parathyroid was hyperactive. Out of four gland, one was very active. Because of that, she is getting stone. So we have done surgery of that parathyroid. We have removed that parathyroid, and now she becomes stone free in the future. Like, yeah, we are following her since last 2 years. She is not forming stone, but she has formed the stone in 3 months. So we have to
Okay.
evaluate the patient, those who are forming stone again and again, especially the calcium, uric acid, and parathyroid level. If they are normal, we have to collect a 24-hour urine of the patient, and we have to check what are the more salts, what are less salts, so that we can manage or we can treat those with the medicines or some dietary measures.
Okay. So that means, doctor, reoccurrence of kidney can be as you have said that a patient has already. So what can be done to help prevent the reoccurrence of kidney stone? What are the precaution measure one should take if the kidney stone is recurring again and again?
That's what we have to I told you, prevention is adequate hydration, weight reduction, and decreasing the solute load in the form of decrease the non-veg intake and salt intake. It should be restricted. It should not be added. It should not be added salt. It should be whatever in the food you should take. Second thing, to prevent, we have to thorough evaluation, that is called metabolic evaluation of the kidney stone. In that, we do the blood test and we analyze the 24-hour urine of the patient. Like we give him a can, and we'll ask him to bring a urine, ask him to collect the urine for last 24 hours. And that urine we analyze for the calcium, uric acid, some proteins, sodium, and we'll found to have that around 60 to 70% of the patient will have some abnormalities in their urinary metabolite. So if you treat that area, you'll have a decreased chance of future recurrence.
Okay, so these are the prevention measures which you can take if you
Yeah.
have kidney stone and it is reoccurring. Doctor, there is one more question from a viewer asking, when should I see a doctor if I suspect I have a kidney stone?
If you suspect, you should consult, at least get a basic ultrasound test done, which it doesn't require any prescription sometime. You can get to the radiologist and get ultrasound done. If ultrasound is not showing any stone, majority of time you will not have the stone. And ultrasound is a non-invasive test, doesn't require any X-ray or radiation, and it is easily available anywhere.
Right. So please go and get yourself checked because it is very important. Don't take over the counter medication, as doctor have already suggested that a lot of people do that and it is harmful for a longer run.
Yeah.
Doctor, before we end this live session, very beautifully explained, very visually presentation of how the kidney stone is formed, how it is treated. It was absolutely amazing. What takeaway message you would like to give to all our viewers who are watching this live right now?
Yeah. So I would like to tell that any kind of abdominal pain you should not neglect. Okay. If you get abdominal pain, don't take over the counter medicine, or even though in emergency you can take over the counter medicine. Next day or when you are free, you have time, you just go to the physician and consult him, get investigated properly. Second thing, the kidney stones are major issues in or major burden for the some people for treatment as well as surgical point of view. And if you go undergo treatment again and again, the kidney function may come down over a period of time, and that kidney function may become zero over a period of time. So we have seen many patients who are landing up in the removal of the kidney if they neglect the stone. To reduce the stone or to decrease the prevention, I already told you, hydrate yourself. Water is very important. Water is the cheapest or no cost medicine for the stone prevention. You don't require anything to pay for water. So second thing, the weight reduction is important. You should be reducing weight. You should reduce your intake of non-veg, and excess salt over the table salt you should reduce. And once in a year you should check your kidneys or with simple ultrasounds. Ultrasound will cost around 500 to 600. So to that, ultrasound will not only rule out kidney stones but other pathologies of the bowel or intestine or abdomen, they will just rule out.
Right. So don't take over the counter medicines, eat
Yeah,
healthy.
another thing I want to tell you, over the counter painkiller, they directly affect the kidney vascularity, kidney blood supply, and the kidney function will come down if you take continuously the painkillers. So your creatinine will go up, and sometime you may end up in dialysis also.
Okay, that means over the counter medication is very harmful.
Yeah.
So if you suspect any kind of pain, do go to a urologist because they know better. Also, thank you so much, doctor, for such beautiful visual representation, explaining us what is kidney stone, how we can prevent them. And thank you so much, Dr. Gopal Ramdas,
Yeah.
for your
Yeah.
valuable time. And
Yeah.
it has been quite an informative session for our viewers. And we really look forward for many more sessions in the coming time as well, doctor.
Sure, ma'am. Sure. Thank you.
Thank you.
Thank you so
Thank you
much.
so much,
Yeah.
doctor.
Yeah.
Thank you to all the viewers for an excellent participation. For more information and updates, stay connected on our Facebook page, that is Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you and good day to you all.